Hello, Lindsay. My name is Dan. I'll
Hi,
be interviewing you today.
Thank you.
Please have a seat. So how are you doing today?
I'm doing great. How are you?
Good, thank you. So tell me a little bit about yourself.
Well, I'm a recent Ithaca College graduate. I passed my boards. Everything's all good. I'm extremely passionate about my career. I'm so excited to start applying all the knowledge that I've gotten through Ithaca College and really ready to see some results.
Good. All right, great. All right, so why are you actually interested in working for this organization?
Well, doing some research on your organization, I found out that you are so all-encompassing. You have so many opportunities for growth, and you have outpatient, inpatient, different community events to involve the whole community, which I think is great. Your adaptive services seem really awesome. Being able to get people out water skiing or snow skiing and golfing who might have thought they would never be able to do that again. I think that's really motivating.
Good. Okay, so for this organization particularly, we both have outpatient and inpatient. Are you focused on one particularly, or are you flexible to work in both areas?
I'm pretty flexible to work in either one. I think right now I'm really interested in working with the inpatient, with the stroke and neurological rehab type of patients.
Okay. So now you talked about growth a couple minutes ago. Where do you foresee this company, where could you grow? Like, where could you contribute to our growth?
Well, I'm very knowledgeable. I'm extremely passionate. I love communicating with people. I think I bring a lot to the table in my communication skills and being able to really zone into my patients and kind of get a feeling of their feelings and how they're progressing with their emotional status as well as their physical therapy status.
Okay, so about this job, you've already described a couple things, but can you go a little more in depth and talk about what's really interesting to you?
This job offers a lot of opportunities to really see growth in patients. Stroke patients come in, and the progress that they see that we can help them with right away is so great and so motivating, and really makes me feel like I'm actually doing something.
Doing good?
Yeah, it's just
making
very,
a difference.
Yeah, it's really great.
Okay, good. All right, so tell me a little bit about your strengths and then tell me about your weaknesses.
Okay. Well, I'm a very organized person, so I find time management to be very easy. I am pretty great scheduling-wise, being able to get all of my minutes in with my patients and really being the most efficient physical therapist I can be with that. I'm very open to constructive criticism. I love finding areas that I can improve in myself, so just being very open and willing to improve is probably my two biggest strengths. My biggest weakness is, of course, I'm a huge perfectionist, which I wind up finding myself spending a lot of time making sure everything is perfect and that I've done a thorough job, which I've never really had a problem time managing. It's more just kind of, I focus on it on my outside time.
So you're willing to do work like during the lunch period and afterwards in order for things to get done throughout the day?
Almost definitely.
Because you are a perfectionist and you're going to spend every minute with your patient, but
right.
Make sure that you have the paperwork and all that done.
Yeah.
Okay, good. All right, so now you've gone on a couple of clinical affiliations. What experiences has prepared you for this job?
Well, my second clinical affiliation was in a subacute rehab facility in Geneva, New York.
Okay.
And just being around those types of patients, stroke patients, joint replacements, the whole spectrum, really opened my eyes to all of the different patients and emotional struggles that they'll go through. Being a mentor for those patients and a cheerleader almost for them, kind of getting their motivation up when they don't see it anymore, is one of the most rewarding things.
So it sounds like you're pretty confident with this population and working with them.
Yeah.
Good. About that, tell me about the most difficult patient you had and how you kind of got past those barriers that you encountered.
My most difficult patient was a patient who, and as a student on my clinical affiliation, she knew I was a student and she was very difficult trying to kind of get away with things because she knew I was a student. But I think the biggest thing was to just kind of sit back and realize that yes, I am a student, but I'm not going to let you slip on your exercises. You still have to do these, and explain to her why they will benefit her, herself, versus why I want her to do them. So making her see why they're important for her.
And throughout the clinical, did it improve and the patient started to understand that and started to work with you?
Yes, there was one point where she actually made that connection that, oh wow, this is actually for me. So that was great.
Okay, where do you see yourself in 3 to 5 years from now?
I would love to be here. I see myself taking a lot of continuing education courses. I love gaining new knowledge about things. I am very interested in your Fit for Life programs, which encompass the whole community and just give great opportunities to everyone. If I could possibly become involved in those as well.
For continuing ed, is there any specific specialty that you'd like to get into in the future?
I would love to take some more continuing education courses on neurologic rehabilitation and different...
Perfect for this place.
Yeah, just different treatments that I can use with those patients.
Okay. One final question. How do you incorporate with this patient setting, how do you incorporate health and wellness into your intervention?
Health and wellness is a huge part or a huge component in getting any patient better.
Mm-hmm.
Kind of getting a feel for their nutritional wellness, any little red flags that might pop up, just kind of telling them, by incorporating a lot more, vegetables and stuff into your diet, that can help your healing process, and just even giving them surveys, seeing where they might need some more attention to benefit their whole health being and how that can affect their, humeral fracture or
incorporating a lot of patient education.
Right.
Getting them just educated about what's going on and how they can just as a whole become healthier.
Right.
Good. Okay. Now, do you have any questions for me?
I would like to know about how many patients you see a day.
Well, it can fluctuate. You'll see a patient anywhere from 1 to 3 hours throughout the day. And the schedule, like I said, it's kind of all over the place, but you'll probably see anywhere from like 6 to 10 patients throughout the day. And you do actually work with some other occupational therapists or speech therapists at times to co-treat. So it's kind of intermingled, and the schedule does change a lot, but it's easily workable and it doesn't really ever cause a problem.
Yeah, I do love that everyone is so connected, OTs, PTs, speech path. I think that's so important for our field.
Agreed.
Yeah.
Any other questions?
No, that's it.
Okay, well, thank you.
Yeah, thank you so much for your time.
Have a good day.
Hello.
Hi, nice to meet you.
I'm Lydia.
I'm Victoria.
Thank
Have
you.
a seat.
Thank you for having me today.
Oh, of course. course. So can you tell me a little bit about yourself?
Yes. First of all, I just want to say the facility is beautiful. You just have a lot going on here that I think is, you're doing great work. So I'm excited about this opportunity, and thank you. So my name is Lydia Nitchman, and I just graduated recently from Ithaca College with my doctorate in physical therapy, and I passed my board exam, so I'm ready to enter the workforce and
Good.
put to work everything I've been learning. And
Very good. Is that a copy of your resume?
yes, it is.
Oh,
Yeah.
thank you. Why are you interested in working for us?
Okay. So when I grew up in New York City, and so I've been hearing about Burke Rehabilitation Hospital for a long time, and I always, I wanted to look more into what kinds of treatment goes on here. And so as I was looking at the website, I was very impressed by just how patient-centered the care is here, and how different disciplines of rehab work together in order to help the patient gain back their maximum level of function. Something that also attracted me to your organization is the fact that in the mission statement it says that the organization will provide care even if the patient cannot pay. And so that's something I feel very strongly about in providing access to quality health care regardless of socioeconomic disadvantages that a patient might have.
Excellent.
So I really like the charity care policy of your organization.
Have you done any pro bono work outside of or prior in college?
During my clinicals, because I was working under a licensed physical therapist, I wasn't able to actually do that, but if that is something I would want to do. I've done some volunteering with physical therapy related experiences, and I really want to do my best to provide access to people that really need care but maybe can't afford it.
Okay. So yeah, I see here you were a camp counselor for, it looks like just you worked with one person?
I worked one-on-one in a cabin of about 15 girls who had muscular dystrophy. So I worked one-on-one for the week, but I've been able to see different types of muscular dystrophy.
Excellent. So that is something that we see here. We do see a broad range of patients. So what other types of experiences outside of just working with peds do you have?
Yeah.
Can you elaborate on your clinical experience?
Sure.
Okay.
As part of the curriculum that I see, I've done 2 clinicals in outpatient and one that focused on inpatient rehab, and I saw a little bit of neuro there, a couple of patients that had Parkinson's disease and a few people that had had strokes. So I've gotten a little bit of exposure. More so it's made me very interested in that population, and so I want to learn more about it. I know that I don't have a lot of experience in that area, but I really like learning new things about new techniques, how to work with that kind of population.
Okay. So we actually see a broad range of people, including just orthopedic and sports injuries as well. So do you have any experience in that area?
I do. Like I said, I have done 2 clinicals with orthopedic injuries, so post-operative as well as just different sports injuries or ankle sprains and things like that.
Excellent. So what interests you specifically about the job that we're offering?
The thing that most interests me is the ability to work one-on-one with patients and really encourage them to keep working hard with their rehab. I know that patients that have neurodiagnoses tend to get discouraged a lot, and a lot of them are prone to depression because their injuries are so drastic. So I really want to be working in an environment where I can be an encourager to my patient and help them to stay positive during the rehab experience and provide them with sound, clinical judgment, as well as, do more research to educate them really about their prognosis and how they're doing their therapy.
Okay. And so have you done that in the past? Have you had experience with maybe a patient who had some psychological impairment?
Mm-hmm. There was one patient that I worked with at my subacute rehab clinical, and she had a lot of different psychosocial factors going on, but she had chronic low back pain, didn't think she'd ever get better, and so it was a lot of listening to her and letting her explain other things that were going on in her life that may have been impacting her or limiting her progress in rehab. And so, trying to help her choose to believe that she's going to get better and not be limited by, by fearing that she'll never get better.
Mm-hmm.
So,
absolutely, very important. So, can you tell me about your strengths and weaknesses?
Okay. So I believe an area of strength of mine is that I'm very flexible. I'm very dedicated to my work, and I'll stay until the job gets done. In my past clinicals, I've come in earlier, stayed late whenever, I needed to cover for somebody else. And I really contribute to the team. And I also am, I'm committed to improving myself in my areas of weakness. So I'll go home and research different things that I don't know, or just accept feedback without becoming defensive.
Okay. So you're saying that one of your weaknesses is you're not completely an expert in multiple things yet. You're not as advanced, experienced.
I think that I lack experience in especially the neuro sector of the clinic, but I am very interested in it, and so I think that because I'm interested in it and excited about this area of clinical practice, that will help me to really develop my skills and do more research about it, and even participate in one of the research topics that is currently going on here at the hospital.
Okay. And so, can you think of any experiences that prepared you for this job, or that would make you more competent?
Mm-hmm. Yeah. So, outside of physical therapy, I've worked for a scheduling office at Ithaca College. And so I've also worked to assist an event planner. So I've had to negotiate communication between multiple people, problem solving, trying to make the client happy, even if their first choice didn't work out as they expected. So I've had to do a lot of kind of just communicating with a lot of different people in a high stress environment.
Oh, yes, of course. Okay, and how about where do you see yourself in 3 years from right now?
Okay, so in 3 years, I would really like to be pursuing a specialty area of physical therapy, and right now I believe that neuro rehab could very possibly be that area, because I am so interested in it. And so like I said, I would love to get on board with the research topics that the hospital is investigating, and just learn as much as I can about different diagnoses and learn more techniques from research, as well as clinicians that are more experienced than I am, and so eventually maybe pursuing a specialization in neuro rehab.
Okay. Have you considered any residency programs?
Not for right now. Depending on how it goes, you know, working in the area of rehab. I want to get my feet wet in what the real world of neuro rehab is like, because I didn't have as much experience with that in clinical experiences during school. So depending on how that goes, I'm open to a residency, but I'm not sure right now.
Okay. Alrighty. And how about 5 years from now? It's a little bit.
Yeah, it's a while from now.
Right.
So 5 years from now, I would like to be, you know, satisfied in whatever specialty area that I pursue. So hopefully neuro rehab, and I also want to have been have accomplished a research topic of my own topic of interest in that area. So along with my colleagues, directing a research study and maybe presenting at a conference about it.
Okay. Excellent. Very good. So do you have any questions for me?
I do.
Okay.
So I noticed on the website that that patients get up to 3 hours of therapy per day, and I was just wondering if the physical therapists work together with the occupational therapists and the speech language. Okay. Another question I had was, as far as continuing education courses, are there specific recommendations for solely rehab techniques and interventions, or can you kind of step outside of the neuro rehab?
Oh yeah, absolutely. We encourage people to check out some other areas, and you know, the more you know, the better you are with a diverse range of patients, and we try not to turn anyone away. So that's definitely a benefit to you to experiment outside of the neuro field. Okay.
All right. Well, thank you very much.
You're welcome.
I really
It was very nice
appreciate it.
meeting you.
Thank you. You too.
Hi, Sheila.
Hi.
How are you?
I'm fine, thank you. How are you?
Good. You can take a seat right here.
Thank you.
Okay, Sheila. So tell me a little bit about yourself.
So my name is Sheila Pierre. I'm a recent grad of Ithaca College, the Doctor of Physical Therapy program. I recently passed my boards, and I'm looking for to start a career opportunity as a doctor of physical therapy.
Great. So why are you interested in this position?
So, looking into your facility, I realized how you have a community approach, and you have both inpatient and outpatient, and I'm interested in working with both populations because I feel like I can add to both populations, so pretty much.
Okay. Do you have an idea one way or the other, outpatient, inpatient? You kind of just...
I feel maybe more so inpatient, only because I like the one-on-one and the closeness of working with the patient. And also with inpatient, you get to see more of a progress and work more with the patient as they're in the facility. So I'm really drawn more to that, helping them.
Great. Have you worked with inpatients before?
Yes, my recent clinical affiliation, I was in a subacute in Florida, and it was very challenging at first because my previous affiliation was outpatient, but as the weeks went by, I really fell into working with the patients in that setting. So.
All right, great. So tell me a little bit about your strengths. Give me something that stands out about you.
Okay. Strengths, I would say I'm a very motivated person. I'm strong in my thinking and beliefs, but I am also a team player. So I would like to say that I can lead, but also follow if need be. And so I think that's a good quality to have. I'm optimistic, but also realistic. I like working as a team and with different inputs with people. I'm cooperative, friendly, and I do have a strong sense of interpersonal skills with people, so I think that adds a lot to it.
Great. What about a weakness? Anything that you can improve on?
Yes. Well, yes. Weakness, I would say I do have trouble delegating tasks, mostly because I feel like, you know, I need to make sure that it's done a certain way. So I want to make sure that it's right. And so I have trouble probably not trusting others, but giving them the task that, like delegating a task that can be easily done by someone else. So I probably take on a lot more than I should.
Okay. So where do you see yourself in 3 or 5 years from now in the future?
Hopefully working for Burke Rehab. Also continuing my education in physical therapy, mostly probably starting a certification in manual therapy because that's something I'm interested in. And overall, probably partaking in some research, as I saw you guys have a research department. So that would be something I'd be interested in and looking forward to.
Great. Are there any specific research opportunities that you're looking at?
I have not, no, I haven't, nothing's really drawn to me, but I'm hoping since I haven't had much experience, as my experience grows, that something will stand out to me and I would probably help, start a new research process at Burke Rehab.
Great. Are there any other questions you have for us, our facility?
I guess, what are the typical hours?
Well, generally, some people come in around 7:30, working until 4:30. Those are the general hours. We also have part-time employees who come in for half a day, either in the morning or in the afternoons. Really can fit to your schedule. Yeah.
Is there room for advancement in this facility?
Oh, definitely, yeah. We usually start out, physical therapy, and then there's always opportunities for growth.
Right. Okay. No, that's about it. I just wanted to say that I appreciate the opportunity of this interview, and I'm looking forward to sharing and growing with Burke.
Great.
Yeah, so.
It was great to meet you.
It was great to meet you, Lindsay.
Hello. Hi, nice to meet you. I'm Victoria.
Hi, Victoria. I'm Sheila.
Okay.
Welcome to Burke Rehab.
Thank
Hospital.
you. Here's a copy of my resume.
Okay, thank you. How are you today?
I'm doing well. How are you?
Good. Okay, so let's start off. Tell me a little bit about yourself.
So I just recently graduated from the Ithaca College Doctorate of Physical Therapy program.
Okay.
And I just took the licensing exam.
And you passed.
And I passed, so I'm ready to start working.
Good. Okay, so why are you interested in working for our organization?
Well, I really like how, first of all, you treat your employees. I think it definitely trickles down to the patients. I think if your benefits to the employees are good and you advocate strong professional development, then I think the patients can experience the best care possible. So I really like that about your company.
Okay, that's good to hear. So what interests you particularly about this job?
Well, I noticed that it was an outpatient position that you're offering. And so my recent clinical affiliation was in an outpatient orthopedic clinic, and I loved it. And this was really a great experience for me because I worked with such a diverse range of people. So I've seen a plethora of neuromusculoskeletal disorders, and I think I would be prepared to jump right into this type of setting.
Okay, so we do have an inpatient part in our facility. Do you have any experience in that at all?
I do. My last clinical rotation was in a skilled nursing facility in Charleston, South Carolina. And yeah, so we saw the average age range was upwards of 70. So we did see a lot of degenerative disorders, a lot of wheelchair-bound patients, so I know how to navigate around those barriers when treating an individual. So I do have experience in the inpatient area.
Are you drawn more to a particular population?
I think as of right now, I do prefer outpatient, and that's just because I think their capacity to rehabilitate is a little bit broader than maybe some of those older individuals, especially in the nursing home.
Right.
So.
Okay. So let's see. Tell me about a conflict you may have had. Are you good at working out conflicts, or have you had any experience with any conflicts that you'd like to share?
Personally, I think we have all experienced a scheduling conflict.
Okay.
So I had one patient who, in outpatient, we have, as you know, we have very short treatment sessions, and we had one patient who would come 20 minutes late for her 20-minute long appointment.
Right.
So we had to find a way to kind of plan ahead for her and make sure, we could multitask if she was planning on coming in that particular day. So the way we manage that conflict is we just discussed with the patient. We also discussed with the office staff, the administrative staff, and we made sure that it was the best we could do, and we were still being kind and respectful to her, even though she was not very punctual.
So tell me about your strengths and weaknesses, if you have any.
Okay. Well, I try to be optimistic but realistic at the same time. So I know a lot of situations involve patients who may not optimally recover, or they might just plateau, and at that point you would have to discharge them, or certain psychosocial factors like their socioeconomic status or something like that might set them back a little bit. So I try to facilitate the best recovery for them by utilizing some methods of treating them the best that I can. So some of my weaknesses, one in particular is communication. Sometimes I have a difficult time communicating to the patients' families about exactly what they should be doing on their own if they're not being very compliant. Sometimes I just try to avoid causing or confronting the patient regarding something that is really sort of setting them back. So I think I could get better at that. I definitely need more experience and to just sort of really try and deal with those matters head on rather than tiptoeing around them and really bring them out into the open.
That's good. Okay, so what experiences have prepared you for this job?
So I have a lot of experience in community service and involvement.
I see that on your resume.
Yeah, so I love it. I love philanthropy and helping people. And so I have volunteered for blood drives for the Red Cross. I volunteered for service days for Ithaca College affiliated events. So that's really my passion. I just love helping people. And so I think since you guys offer community involvement events, I would definitely be willing to dedicate, my weekends to coming out and really showing my support outside of really my clinical work.
So here at Burke, we have a research department, and I'm wondering if you would be interested in that.
Oh, absolutely. So I have a little bit of research experience. So for my minor, which is exercise science, I worked with an individual who was affiliated with the college. He was diagnosed with young onset Parkinson's disease, and my passion is really biomechanical research, like gait analysis. So I worked with this patient. He's actually involved in a cohort study, so they're kind of seeing his progress or lack thereof over a course, a series of years. What we did was we used kinematic and kinetic software. We used force plates, and so I have a lot of experience with that. And we also typed up a research paper for that, so I know the formatting. And I love it. It's very enjoyable for me.
So where do you see yourself in 3 to 5 years?
Hopefully, I would hope to just be strengthening the skills that I kind of have a foundation of right now. I definitely want to get involved with more of the research aspect of physical therapy, because I think it makes you a better clinician overall. Definitely, if you have some of that supporting evidence that you use with every patient, you get them more on your side, and you can make them more compliant. So I do enjoy that, and that's probably what I would like to. I would like to be in a stable area, and I do love this area. It's close to home. It's beautiful, suburban. I think this is the location that I could see myself working for long term.
So one last question. Overall, what do you see yourself adding to our team?
I think I am a valuable asset because I definitely work hard. I have excellent work ethic. So I'm willing to dedicate the extra hours, and I think your career is definitely a large part of your life. So although it'll probably be my main concentration. So that's what I think I can dedicate a lot of time and effort and knowledge to your company.
Thank you. Do you have any questions?
So what are the typical hours like from day to day?
Okay, it ranges depends on the therapist, but typically you can start 7 to 5:30. That's a typical range, but it really depends on the demand of what we're facing with the therapist. So we work with the therapist and the scheduling of patients and what we're seeing at the time, so it's not really set.
Okay. Also, for my first clinical rotation, we had weekly meetings with all of the therapy staff,
yes,
including speech and OT.
Exactly.
So do you have that same sort
We
of
do
thing?
have that. It's usually on Tuesdays. Tuesday mornings, we have a group meeting with every specialty that works in the rehab center. So you could look forward to that.
Excellent. And from your own experience, do you think everyone sort of works well together?
It definitely is a team effort. There are some discrepancies, but altogether it's a team effort.
Okay.
Working.
Excellent. Thank you so much.
No problem. It was nice meeting you.
It was nice meeting you too.
Hello.
Hi.
Hi.
How are you? My name is Yenny.
Hi, Yanni. I'm Lydia.
Nice to meet you.
Welcome to Burke Rehab.
Thank you.
You can have a seat.
Thank you. Here's my resume.
Thank you. You would send this over in the email.
Yes, I did.
Great.
Okay. All right, Yanni. Well, welcome to our facility.
Thank you. It's a very nice facility.
Thank you. We do our best. So can you just start out by telling me a little bit about yourself?
All right. I'm a recent Ithaca College grad. I graduated in May and sat for my board exams and passed them. And so I'm interested in women's health generally and orthopedics. I just sort of love those two equally right now. And I'm just interested to work in a facility that will not only offer me the opportunity to practice in both of those areas, but also receive some form of mentorship since I am a recent grad.
Okay. All right. That's great. You do know that
Burke Rehabilitation is primarily a neuro rehab hospital?
Absolutely, yes.
Okay.
Yes.
All right. Can you tell me a little bit about how you would want to work in our facility, having your interests and then it being primarily neuro-focused?
So as a recent graduate, I think that I would do myself a disjustice if I were just to work in a very specialized area. So although I'm interested in women's health and orthopedics, I think it'll be great exposure for me to get a little bit of neuro, just to see what's out there. And even more so, I realize that patients come with not just one diagnosis, they come with multiple diagnoses. So if I see a patient that maybe has a little bit of women's health and some orthopedic needs as well as neuro, I'm more than happy to be flexible and just to open up the opportunity to learn even more. And so I realize that most of our clients will have neuro limitations, especially since this is the population of the baby boomers, and that's a lot of what we'll see. So I'm very comfortable in the fact that that's where I need to be right now. So.
All right, great. Along the same lines of that, why are you interested in working for our organization specifically?
Okay, so I love that on your website I noted that you all are interested, or your goal is to maximize the recovery time, and you also have an emphasis on research. I love it that you all do have an emphasis on research, because I think it's very important as clinicians to keep up to date on what's out there, what's going on, and be very knowledgeable about better ways of treating patients, faster recovery time, because the whole point is to get people that better quality of life and to get them back to a functional state. Mm-hmm. And so if I'm in a facility that is constantly doing research, constantly looking for ways to improve itself, I think that also helps me and challenges me as a clinician to always push the envelope and not just stick within the conservative, humdrum ways of doing things, but look for ways to just improve and do things a little bit better.
Okay, so, yeah. Great. Have you done any research in any area of physical therapy?
I haven't done any research independently. The closest amount of research that I did was just as an aid to someone else who was doing research regarding using technology in order to manage adherence with home exercise programs, and that was in the clinic at Ithaca College where I went to school at. Aside from that, I just do ongoing research on my own just to find out new information about selected topics in women's health, as well as any other spine-related orthopedic type of injuries.
Okay, all right, great. What interests you about this job at Burke Rehab?
I do love Burke Rehab, like I said, because of the maximum recovery and the research. But one thing I really enjoyed is seeing that you guys care about community education, which I believe is very important. I saw that you have a list of programs that you're constantly doing that will engage the community in different ways. And more particular, I saw that you have an osteoporosis awareness group, which would interest me very much to be able to engage with the community as a clinician. I think helps me keep with the pulse of what people are really caring about, what their concerns are, because it's not enough for me to provide my skills and just look at objective measurements and just look at ways to help them out physically, but they must be able to know that I care about their emotions, I care about their psychosocial needs and all. So I really love that you guys are very much holistic in that nature, and I think that I can definitely not only benefit but also give back in that regard.
Okay, yeah. That's great. Can you tell me about a patient that you worked with that maybe needed some kind of emotional or psychosocial support?
Yes. So I had a particular patient who just came in for a routine ankle sprain injury, and I saw that she also had a lot of external factors that were affecting her being able to rehab at a successful rate. She would, talk a little bit about her family struggles, her being the sole financial provider for her family, just really affected her emotionally, and it didn't allow her to adhere to her home exercise program. It didn't allow her to even be able to meet her, go to her appointments, her doctor's appointments, at a good time. So it really just affected her being able to focus on herself and focus on getting better. So I was able to speak with her regarding some of these limitations, and then together we sort of made goals and figured out better ways for her to manage her needs, place herself as a priority, while also managing all of the external factors and responsibilities that she had.
Okay, all right. Now, can you tell me a little bit about your experience with patients that have neurological diagnoses? I noticed you had a few noted on your resume, but can you just tell me a little bit more about specifically what kinds of diagnoses have you worked with and how your response to working with them?
So I've had a couple of clinical experiences. I'll start first with one that I had while I was in undergrad, and it was I worked within a facility called Longview Rehab Center, and I worked mainly with patients who had suffered a CVA. And what was unique about this experience is that most of these patients had had a CVA for about 3 or 4 years. It wasn't something that was very new. So for me as a clinician, it challenged me a lot because now I had to just work on maintaining. It wasn't about necessarily making any leaps and bounds and objective findings, but it was more so of, okay, what can they do to have a better quality of life? So that was one of my experiences with that. Like I said, mostly with CVA, but I had another experience in a subacute rehab facility where I worked not only with patients who had suffered a CVA, but also patients who had diagnosed with Alzheimer's, dementia. And so working with those different neuro diseases, I saw that the fact that they were degenerative in nature, and so there was nothing I could do about necessarily stopping or solving their issue, but there were many things that I could do in slowing the progression and helping them again to improve quality of life.
Okay, all right. Can you tell me a little bit about your strengths and your weaknesses?
Okay, so I think one thing I really enjoy doing is getting to know the patient and providing a very client-centered approach to my treatments. And so I'm all about finding out how can the patient benefit from me best. What sort of goals do they have? Do they want to get back to riding a bike again, or do they want to get back to driving or more independent lifestyles? And also realizing that they may have all of these great goals, but making sure that they're educated on, okay, these are your limitations, but here's the medium point where we can meet and we can compromise and work on this together. So I'd say that's a strength of mine, is to really find out what the patients want to do and provide a client-centered approach. Yes, that's good. But as far as weaknesses go, I think that as far as I'm concerned, being a novice clinician, I am sometimes intimidated by very complicated diagnoses. So if there's multiple things going on, sometimes I'm not sure what to prioritize first. But I do believe that with ongoing experience, I will learn what to prioritize first, and hopefully be able to not be so intimidated by the multiple diagnoses I see.
Okay, great. And you had mentioned, that you are strong in patient and client-oriented care. Can you tell me about your ability to work with family members of these patients that come in?
So I have an example of a particular patient that I work with. She had a neurodegenerative disorder. They actually did not know what she had, but I believe it was some form of dementia. So she really could not be her own advocate. She couldn't speak for herself. So her husband used that as an opportunity to make sure that he speaks for her. What sometimes that did was that he would ask us to do things and demand things of us that weren't really in compliance with her goals or what really needed to be done and what was prioritized. So I often had to pull him to the side, make sure that he understood why we were doing what we were doing, but more importantly, I would engage him in treatment time. So I would say, hey, why don't you sit down and do these exercises with us, or do you mind holding the TheraBand while she does these range of motion exercises and so on. So that's sort of how I handle that.
That's great, great. So Yanni, what experiences have prepared you for this job?
So aside from the ones that I noted earlier, being in a subacute setting, I have also have experience with manual therapy. Working with my hands a lot has helped me to gain confidence in being able to treat patients, not only with my clinical reasoning skills, but being able to work hands-on has really given me a lot of confidence in that. And so I would say that, just like the examples I gave you before, I think that my experience in the subacute setting, all those experiences along the way, being an undergraduate and seeing patients with CVAs and the different neurodegenerative disorders has probably been the best thing to prepare me for this type of job.
Great. Now, in 3 years from now, where do you see yourself?
I see myself really delving into a lot of continuing education. I would see myself getting more experience in women's health, and hopefully maybe even doing something here where I can expand on what you already do in developing more women's health awareness, even if it's doing more community development. And then also I would love to do a little bit of research while I'm here as well. I'd love to do research to bring on maybe more awareness about osteoporosis, since that's the patient population we'll be seeing, but also maybe even being something unique like meshing neuro diseases, as well as understanding a little bit about, or doing more research in women's health, neuro. I would like to just combine and do research.
Okay. Yeah. You mentioned osteoporosis. We don't currently have an ongoing research investigation about osteoporosis. How do you feel about that?
I think that's an opportunity for me to work in. I'm more than happy to do that.
All right, great. Now, how about 5 years from now? Where do you see yourself?
My dream is to eventually work within an obstetrician and gynecologist office as a women's health clinical specialist. And I know that you all do not necessarily have that, but granted, I do realize that, again, you have opportunities to grow, you have other branches. So I would love to work in that area to cater to a variety of women's health clients with different diagnoses.
Right. Yeah. Now, it seems like from different things you said in the past few minutes that you have an interest in the outpatient sector of things. Are you interested in particular in the outpatient or inpatient of sections of our hospital, one more than the other?
I would say that I'm more interested in the outpatient
Okay.
setting more because I do feel like I do see different types of diagnosis, and that's what's challenging about it, and I love being challenged every day. So,
Okay.
not as if inpatient isn't challenging, but I
Right.
do enjoy outpatient.
Okay. All right. Do you have any questions for us?
Yes, about how many patients do you all see a day, and how long do you have for treatment times?
Okay, great question. So we have, each patient is seen by physical therapy for anywhere from at least 1 hour to 3 hour long sessions. That's a long time, so not every patient is seen for 3 hours. So depending on how long the treatment session is for that day, you can see anywhere from 8 to 3 patients in a single day.
Are you given any opportunity as clinicians to sit in on family meetings or any multidisciplinary meetings?
Yes, we do have care plan meetings regularly every 2 months, or 2 weeks, just to update the family and the patient on their status in rehab. So the speech pathologists, the OTs, the PTs, the nursing staff, everybody comes together and the family's invited so that they can talk about their progress and talk about discharge planning and things like that.
And how comfortable is your facility on going to do home care assessments just to see if the home is adherence to some of the limitations that patients does have?
Right. We do have home assessments that we do. Not every patient needs them, depending on this involvement of the case, but we do. That is something that we do on a regular basis.
And do you all provide any aid for continuing education or conferences that your clinicians may be involved in?
Yeah. So in the first 2 years of an employee's time with us, we pay for 75% of the continuing education course, and then once they're here for 2 years, we pay for 100%. So that just helps with our retention rates and is an incentive for employees to, stay long term, because that's what we're looking for.
All right.
So,
Thank you very much.
all right. Yep.